Anatomy of the nose. The upper third of the nose is made up of the nasal bones and is called the bony vault. The middle third is the cartilaginous vault and composed of upper lateral cartilages. The lower third is composed of the lower lateral cartilages, the lateral crus and the medial crus, and the surrounding soft tissues, together with the lateral crura, are known as the tip. Before rhinoplasty, a facial analysis is done and the nose is evaluated in the relationship of the whole of the facial aesthetic. Then the surgeon discusses mainly the 6 changes in parameters of the nose, in addition to other details: symmetry, width, profile, projection, rotation, and nasal length. Symmetry. The axis of the nose should be on a line passing down the midline. Width. Ideally, there should be 2 curvilinear lines passing on the dorsum of the nose, known as brow tip aesthetic lines. Profile. Ideally, the dorsal profile should be straight in males, whereas it can be slightly concave in females. Tip projection is the distance of the tip from the face. It can be normal, over, or under projected. Tip rotation is the location of the tip on an imaginary arch touching the forehead, tip, and chin. It can be normal, under, or over rotated. The length of the nose is the distance from the root of the nose to its tip. The rhinoplasty can be done by endonasal or external approach. In the endonasal approach, all incisions are done from inside the nose. Endonasal incisions are done around the lower lateral cartilages, intercartilaginous, transcartilaginous, and marginal. Whereas in the external approach, there is an inverted V incision on the columella, and the rest of the incision is also included inside the nose. The nasal septum is composed of the cartilaginous and the bony portions. Deviated cartilage and bone can be resected to correct nasal obstruction due to the deviation. An L-shaped, sufficiently wide cartilaginous septum is left in place to prevent saddling of the nose. Straight fragments of cartilage and bone can be reinserted. In both approaches, the lower lateral cartilages can be exposed, can be seen by lift or any intervention. Tip exposure by endonasal approach. Each lower lateral is handled separately via each nostril. Tip exposure by the external approach. The lateral crura, the domes, and the medial crura can be seen by lifting the skin without distortion. The soft tissues over the cartilage and bony vault is elevated. The bony hump can be removed by rasping, and the cartilaginous hump can be resected as one piece by a scalpel. Another method is to remove the septal hump after dissecting and preserving the upper lateral cartilages. The third way of getting rid of a bony cartilaginous hump is the use of dorsum preservation techniques. The septal cartilage is resected from inside the nose, then osteotomies are done to push or let the hump down. In patients from the Far East, there's a need for augmentation of the dorsum rather than reduction. In these cases, cartilage from the nasal septum, ear, and rib can be used. In the Far East, alloplastic materials such as silicone and Gore-Tex are also used. Augmentation by diced cartilage in fascia or augmentation by solid ribs. The bony hump can be removed by an osteotome, a rasp, electric burrs or saws, or piezo instruments, mostly depending on the situation and the expertise of the surgeon. The tip of the nose seems aesthetically more pleasing after volume reduction of the lateral crura, mostly by cephalic trim and some cartilage sparing techniques such as the lateral crural flap turn-in technique. After removing the bony hump, osteotomies, cuts in the bones, should be done to close the open roof and to narrow the bony pyramid. Osteotomies can be done using osteotomes, saws, electric saws, or piezo instruments. Osteotomies can be done from inside the nose or can be performed externally. After removing the cartilaginous hump, the middle vault can be left as it is. However, many surgeons prefer to use spreader grafts or flaps to restore the middle vault aesthetically and functionally. Tip sutures are very popular in rhinoplasty. They're used to narrow the domal arch, give a shape to the lateral crus, increase tip projection, change the rotation of the lateral crura. Domal sutures, septocolumella sutures, and transdomal sutures. Tip grafts are used to support and refine the tip. They are also used to increase tip projection, such as a columella strut, alar rim graft, a tip graft, or a lateral crural strut graft. At the end of the operation, a plaster and a cast is applied on the nose to stabilize and protect the nose during the initial recovery phase. If an extensive septal surgery is done, intranasal splints or packing can be used to prevent hematoma or nose bleeding.